Hello, everyone. I want to talk to you about a few stages of identifying your patient's journey. We talked about really being able to tell their story and how to implement that into your marketing. And today I want to just kind of walk through that process when a client or a patient starts their journey. So the first step is becoming aware. So as a patient, they have identified that something is not right with their body, whether it's how they feel or it is a symptom that they're having, some type of an issue. So that they become aware of the situation. The second thing is they know they need help. So from that awareness to the help piece, that's the starting point of your marketing because they are searching for something. They're searching for resources, whether they are, Googling an issue or a cause, whether they are, using Pinterest. A lot of moms go to Pinterest for different things, whether it's, okay, what does this rash mean? Breastfeeding tips, physical therapy tips, whatever it is. So Pinterest is a really big search engine for women. And so whether they're going to WebMD, whatever those resources are that they are searching on to find help. And then once they've identified that they need help, that it's not something they can do for themselves, that's where, because maybe they downloaded a content upgrade from you, a free resource, maybe they are already a patient of yours, they know that they need help. And so they come to you for that care. And this can be, just that initial visit. So they say, okay, here's what I'm struggling with. And so it's really important to identify and to be able to write down, like, what does this patient journey look like? And for each thing that you work on, at your practice. So, I mean, if you're a family physician, people come in for everything. But what are they experiencing? Maybe what are the top, 10 things people are coming into you to see you? If you're an oncologist, what's that journey like? And then after the care is the treatment piece. And so this treatment can be anything, again, chemo treatment to physical therapy, if you're a counselor, to just some counseling sessions, to maybe a class, if maybe it's like a breastfeeding class, or a special diet, if it's, you're a nutritionist or a pediatrician with children dealing with different issues. So what is that treatment? And then based on that treatment, here's kind of the golden piece of really being able to point out their pain points. And so after treatment, how does that then change their lifestyle? And this is really important because people can struggle with something. Maybe they have a hurt back or, a sore shoulder, or they haven't been able to eat properly for months, or they just feel fatigued, whatever that little piece is. People can live with that for a long time and not even think that it's an issue, that there could be something wrong with them, an underlying issue there. And so you have to kind of play off of, what does that lifestyle look like for them? What do they want to get back to doing? And this is where, maybe it is, whether it's, are you wanting to get on the floor and be able to play with your grandkids? Do you want to see your family grow? Do you want to be able to, be a healthy mom for your newborn baby? What is that pain point and that lifestyle that your patient wants to live? And where are they struggling? How is this issue hurting their lifestyle? So that lifestyle is really, and you'll see this in ads all the time. Can you imagine your life doing the XYZ? Or do you want to live a life free of pain and be able to do this, this, and this? And that's really because they're connecting with their audience, or connecting with their patient. They're listening to what they're struggling with, and they're saying, we're able to fix this problem and help you live that life you want. And then after you're able to provide that lifestyle back to them, then what's that ongoing care? Do they have to come back for visits? Do you give them, homework? Maybe it's physical therapy. Maybe it's different ebooks that you guys have put together. Maybe it's just joining your newsletter list to be able to provide them those tips and those resources. Is it a special diet? So what's that ongoing care, and how do they get that from you? So if you are a pediatrician and you have a lot of people, obviously each patient is going to be different. There's going to be something for them that one needs and the other doesn't, or vice versa. So it's important to have that content for them. But if there's things that you can generalize, so if people are all, if there's a handful of people that are dealing with this situation, let's just say it is kids that are maybe not eating the right food. So how to get those kids to eat healthier. Maybe these kids are now suffering from maybe weight issues or struggling with sugar diabetes or other underlying issues because of the foods that are being put into their body. So as a doctor, as a pediatrician, you want to be able to be a resource for that mother and father and help them come up with creative ways to get their kids to eat healthy. And so you can then, that ongoing care, you can put them into a newsletter for other parents that are struggling with the same thing. So then you're always staying top of mind with them. And I feel like this piece is a piece that can be overlooked a lot of times in practices because we get so busy. I mean, you probably see 100 patients a day. And so then it becomes the office's task and job to be able to make sure that as they check out and they pay their bill or whatever that outpatient process is, that then they say, I would love for you to sign up for our newsletter list. In this process, we provide you this, this, and this. And so they want to be a part of it. You're staying top of mind. They're able to continue to live that lifestyle that they want, and they see the results. And so that is that ongoing care piece, is just once they check out and they pay, what's next? You just wait until the next problem? No, you want them to be proactive. You want them, again, this is that know, like, and trust factor. You're building that trust on an ongoing basis with them. And so it's really important to always be that resource. And especially as a doctor, regardless of what field you're in, your opinions up here. People truly value what you say. And so it's important to make sure that you are touching base with your patients, whether that is just through a monthly newsletter or social media tips or videos or whatever that process is for you. But this is a great way as you kind of document what your patients are going through, and you figure out this could just be a one newsletter list that it has multiple different resources if you're writing blogs. So start thinking of how you can stay top of mind and continue that relationship building with your patients as they leave the door. So that's that ongoing piece. And if you have questions or need help putting together that digital marketing strategy, let us know. We are here to help you.